members of the Health Scrutiny Committee and to our attendees tuned in to watch this committee meeting this morning. Please can we all bear in mind that there may be unforeseen technical difficulties. However, we will aim to keep any such difficulties to a minimum. Members, please ensure that your microphone is muted during the meeting and only switched on when you are speaking. Any members joining the meeting today using a mobile phone can mute and unmute by pressing *6. This will ensure that any background noise in your location will not be picked up throughout the meeting. After each item has been presented, the committee will be asked to indicate whether they wish to speak by using the raise your hand facility in Teams. Can I also remind you all that today is an important day. It's the Marie Curie's National Day of Reflection on the first anniversary of the first UK lockdown. If we're still meeting at 12 o'clock, there will be a minute's silence to reflect on our collective loss and support those who have been bereaved, and also to hope for a brighter future. And I will give you a sort of 2-minute warning if we're still in session at that time. Item 1 are apologies for absence. Gary, this is with you.
Yeah, thank you, Chair. We have apologies from Councillors Bridget Hilton and David Howarth. And we also have temporary replacements, which is Councillor Cynthia Dorelli standing in for Gail Hodson. And we also have Councillor Susie Charles, who is replacing a member who I unfortunately do not know just yet, because the full list of attendees is not here just yet. So I'll keep an eye on that and report back to you later on. Thank you.
Thank you, Gary. Item 2 are the disclosure of pecuniary and non-pecuniary interests. Members are asked to consider any pecuniary and non-pecuniary interests that they may have to disclose to the meeting in relation to matters under the consideration on the agenda. Okay. I can't see anybody wanting to disclose anything, so we go on now to item 3, which are the minutes of the meeting which we held on the 2nd of February 2021. And I will take silence to mean that we agree that the minutes are a correct record. Thank you. Right, item 4 is the new hospitals programme. And I've got a list of people who are attending. I don't know if they're all here or not, but we've got from the Lancashire and South Cumbria Integrated Care System, we've got Dr. Amanda Doyle, the Chief Officer, Jerry Hoker, Executive Director, New Hospitals Programme, Dr. Samantha Mukherjee, New Hospitals Programme, Rebecca Bailin, Programme Director, New Hospitals Programme. And also we have with us Paul Woodford, who's the Director on Morecambe Bay Trust. We've got Dr. Shahid El-Bari, Medical Director, University Hospitals Morecambe Bay Trust. Dr. Jerry Scales, Medical Director, Lancashire Teaching Hospitals Trust. Dr. Jeff Jolliffe, Clinical Chair, Morecambe Bay CCG. Dr. Lindsay Dickinson, Chair and Clinical Leader, Chorley and South Ribble CCG. Louise Barker, Communications Programme Manager, Lancashire Teaching Hospitals Trust. And we've also got with us County Councillor Sean Turner, who is the Cabinet Member at County Hall for health and well-being. So I'll hand over to our guests to make the presentation.
Thank you, Chair, and thank you for introducing the large number of people we have here joining this paper. My name is Jerry Hawker. As you described, I'm the Executive Director for the New Hospital Programme. I shall introduce the paper, very briefly covering some of the key points, but obviously allowing plenty of time for debate and questions. The New Hospital Programme is part of a government initiative to build 40 new hospitals across England, and both the Royal Lancaster Infirmary and the Royal Preston Hospitals are named as part of that programme of work. The paper sets out in detail the context to the New Hospitals Programme, and it's worth stressing that we are still at a very early stage of the programme, but working to a very tight timeline, which is set out in section 4 of the paper. The New Hospitals Programme in itself offers significant opportunity to transform the healthcare services across Lancashire and South Cumbria, but we're extremely mindful, in fact, offers a much greater socio-economic benefit for the people of Lancashire and South Cumbria. The paper also sets out some elements of the case for change. The overall case for change is still in development, but it's very clear there are some very strong underlying reasons why both the Royal Lancashire Infirmary and the Royal Preston Hospital are being considered as part of the scheme. Both of them are old facilities, no longer fit for purpose. Some parts of these hospitals date back to the late 19th century, with significant parts built in the middle of the last century in the 60s and 70s. They don't provide facilities that are in keeping with a modern NHS, and do not offer great access and availability for our population. The New Hospitals Programme enables us to transform those hospital services, bringing in new technology for many of the specialist clinical services that we provide, but also allow us to imagine and think about how healthcare will be provided right the way through to 2050, particularly thinking about how a modern health service responds to the new digital technologies available to improve access both of high quality hospital services, but also how our hospitals of the future will liaise and interact with community facilities, enabling people to have increasingly more complex care delivered closer to home. The programme as it stands at the moment will be exploring a wide range of options, taking into consideration a balance between our clinical models and the ideal clinical pathways that we wish to develop for our patients, accessibility for our population across a very significant geography, and of course, and ultimately, affordability. The paper asks the Health Scrutiny Committee to consider how best we should engage with the committee, and we'd also like your consideration of how the Health Scrutiny Committee can work with other Health Scrutiny Committees across Lancashire and South Cumbria, which ultimately will be involved in this process. Given the extent of the build and the programme overall, it is our expectation that we will be required to go to consultation, with that probably expected to begin in the first quarter of next calendar year. I hope that provides a helpful summary for you. I'd just like to end and reaffirm that comment that we are exploring a range of options, and they will be subject to consultation at a subsequent date. Thank you very much for your listening to that, and we'd like to open the meeting to questions, which we will use the full team that we have here today to answer as best we can. Thank you, Chair.
Thank you. Anybody got any questions or comments?
I have, but I don't know whether you've seen my hand.
Ah, it's just come up now, David. Yes, David. David Borrow.
Just a quickie. I've read the document and it talks about the Morecambe Bay NHS Foundation Trust and the Lancashire Teaching Hospitals Trust. And yet the comments you've just made are in relation to Lancaster Hospital and Preston Hospital. Are we talking about work for both trusts and the hospitals within both trusts, or are we simply talking about the hospital in Preston and the hospital in Lancaster? And secondly, I can't see anywhere in the document anything about the amount of money that is available nationally for this programme for the 40 hospitals. Have we got a figure for that? I know there's money available to develop a programme, but if we're going to build 40 hospitals by the end of this decade, and we've got a treasurer who's saying we've got no money, it would be helpful if we've had some idea as to how much money there was available so that we can work on this programme with some idea of how much it might cost. Thank you.
Thank you, David. The NHS does love to use its acronyms at times to help to confuse the public. So just to clarify, University Hospitals of Morecambe Bay is the trust's name that includes the hospitals at RLI, which is the Royal Lancashire Infirmary, the hospital site in Kendal, and also the hospital in Furness. Lancashire Teaching Hospital Trust likewise is the trust name that covers the Royal Preston Hospital site, the Shorley Hospital site as well. The programme is primarily identified as the refurbishment or rebuild of the Royal Lancashire Infirmary and the Royal Preston Hospital, but I can confirm that we are approaching this as a system to look at all of our hospital facilities across Lancashire and South Cumbria and how they can be networked together. And this may include improvements to other facilities as part of University Hospital Morecambe Bay and of Lancashire Teaching. I hope that explains that question for you.
Yeah, the only other point I'd make is I must be getting very old. I moved to Preston in my mid-20s, but I do remember the Preston Hospital being built from scratch, because I do remember visiting an old boss in the old Deepdale Hospital. So it was built in the 80s, not in the 60s or 70s, from my recollection, maybe the end of the 70s. But when I came to Preston in 75, so the hospital in Preston was at Deepdale, certainly not the one we've got now at Fulwood.
Councillor Collins.
Thank you, Chair, and I want to say thank you for allowing me to speak when I'm not currently a member of this committee. My name's Lizzie Collins.
Oh, Lizzie, just before you go any further, I have to ask the committee if it's okay for you to speak,
of course,
and
Chair.
I will take silence as meaning that they agree to you speaking.
Excellent.
Okay.
My name's Lizzie Collins. I'm the County Councillor for Lancaster East. So my residents use the Royal Lancaster Infirmary and recognise the absolute state some of the estates are in, and are very pleased to hear that there will be some investment in their services. They're also very concerned that one of the possible outcomes is a super hospital to replace the RLI and the Preston Hospital. And what I'm asking for today is reassurance that this will be a genuine consultation and that no decisions have already been made as to future sites for acute care. And also a plea that whilst we absolutely recognise some of the benefits of putting specialisms into specialist centres and the medical benefits that can bring, that we also recognise the need for services to be accessible to people, particularly people on public transport, particularly to people with disabilities, and particularly for family members whose loved ones are in hospital for a very long time. and the knock-on effect of potentially moving some specialist services on other services. For example, I'm a patient representative on the Maternity Voices Partnership for Morecambe Bay, and if we don't have ICU in Lancaster, we don't have obstetric-led care. We don't have any form of surgical birth, whether that's surgical assistance during birth or whether that's C-section, and that's really concerning to my residents and to me, that the knock-on effect of removing some specialisms will mean that the services that really are best delivered on our doorstep are going to be negatively impacted. So 2 key things: please can I have a reassurance that this is a real consultation, and please can we look at this very widely and engage with our residents properly. Thank you. Thank you, Chair. I appreciate you allowing me to speak, and the committee.
Phil Woodford.
Thanks, Chair. If it's okay, as a representative of the trust that looks after Lancaster, I just wouldn't mind answering some of that question. I think, first of all, just to set the context as to how it's Lancaster and Preston, not Lancaster and, say, Blackburn or Carlisle. What we decided at an early stage was, when the government announced funding for these programmes, they've announced what they called seed funding, which is the fancy way of saying we'll give you some money up front to write your bid properly and some time to do your consultation. We decided with Preston, given our closeness, that actually it'd be better value for the taxpayer that we put our money together, and instead of commissioning, say, 2 lots of architects or 2 lots of surveyors, we actually go to them with a bigger pot and get more bang for our buck, if you like, Chair. And that's what we've done around Lancaster and Preston. It's really unfortunate that we've got headlines around super hospital or building a hospital where I live in Garstang. What it hasn't helped my house prices any. I wish it had. But what I would add is that was the bid that went forward. There's no bid or proposal. There's no bottom drawer that says we want a super hospital or to merge the hospitals. And to answer your question, direct, Lizzie, is in terms of will it be a real consultation? It's a great question, and I think we need to go back to the first line of the NHS Constitution. You know, the NHS belongs to the people. I certainly don't want to be part of anything that isn't a proper open consultation for the public. It's not a referendum, so it's not a yes no. And there's no political joke meant tonight. It just deliberately isn't a would you like it here, would you like it there? But what it will be is a meaningful conversation with the consultation with the public and all interested people, because it's a vast area we cover. It's not just Lancashire and Cumbria, it's North Yorkshire as well, in terms of their opportunities to comment on aspects which they can influence. But you're right, whilst it might be clinically led, you know, I sit here as also a representative of a local staff patient group as well. And absolutely, it's got to be about equity and of access, you know, designed for the minority, not the majority, and make sure everybody can get it. And I won't go into the maternity care. You described it really well. For all acute care, if there's no backup emergency service, you know, those consultant-led services can't exist. You know, everyone has to be blue lighted away. So yeah, absolutely confirmation that it'll be an open consultation and be as honest and transparent as possible. We've also, I think, Chair, just for some further assurance for your committee, is we've contracted the national organisation, the Independent Consultation Institute, to also work with us to help QC our processes, to make sure that we are going by best practices as we go along. And we've also joined a partnership with Health Watch as well to help us hear the views of the public. Thank you, Chair.
Thank you.
Thank you, Phil.
Dr. Geraldine Scales.
Thank you, Chair. So my name's Jerry Scales. I'm Medical Director at Royal Preston Hospital, but I'm also a resident of the Morecambe Bay area and have done a lot of work over the last 20 odd years in Morecambe Bay. So I do understand the geography and the challenges. And I think Phil articulated it extremely well. You know, this is a very early point of this process. Absolutely no decisions have been made, and it is, you know, we're very much in listening mode currently. We're working through, you know, what the possible permutations, what the possible options will be. But one thing's for absolutely certain, we need to ensure that all of our residents have access to that high quality care. You're right in terms of the specialist care. There is clear evidence that highly specialist episodes of care have better outcomes if the individuals providing that care are seeing a high volume and maintain that expertise. But we also have a significant opportunity here to ensure that elements of patients' care that don't require that highly specialist part are undertaken closer to home for them, more so than we do in some areas at present. So there's a real opportunity to reorganise the way that we do things, both within the hospital services, but also between hospital and primary and community care, so that people are able to access care as close to home as they safely can do. So just to reassure you that we are very much in listening mode, in planning, looking at all the options. We're working on how we can hear the views of some of those seldom heard groups by working with charity groups, patient groups, etc., to make sure that we are genuinely taking in all the views of our residents. That's not to say that absolutely everybody is going to be 100% happy with whatever the final solution is, but we are very much taking all those views into account.
County Councillor Sean Turner.
Thank you, Chair. Am I okay to speak? Is that okay? I'm not a member of the committee.
Yes, because you're attending as the cabinet member.
Okay. Well, I'd just like to say thank you for bringing this to scrutiny, to health scrutiny. There's a clue in the paper there that says this is a once in a generation opportunity. We have to get it right. That's without doubt, we've got to get it right. And where it's placed and what's placed where is really important, especially as we're talking about developing pathways that we are limited in what we can do with what we've got now in terms of infrastructure. Like I say, it's a competitive bidding process. One, we want to put the best bid in we possibly can. So I suppose my ask to you is there anything you feel we could do to, as well as scrutinise this going through and ensure that, you know, the residents are getting well served? Is there anything we could do, and, you know, anything at all that we could do to help this process as it goes forward?
Right. So I've got Jerry Hawker and Phil Woodford. I presume you want to respond to County Councillor Turner. Jerry Hawker and Phil Woodford.
Thank you, Sean, for the question. Clearly, as I started off, the socio-economic benefit to the region is much more than just the building of 2 new hospital facilities. This brings in opportunities across Lancashire and South Cumbria that we would want to work with all of our public sector and council partners to maximise that. Just to use some examples around that, clearly there's an opportunity to continue to strengthen our relationship with the universities and with local high-tech companies, particularly in terms of research and technology. We'd clearly see there's also opportunities with us thinking about this as a hospital for the future, to think about how, with the support of the council, we can maximise the opportunities around this being zero carbon facilities and maximising the digital connections. We've already had some early conversations with the local enterprise partnership around how we maximise that. So we will continue to welcome that. As we've said, at this stage, it's very early in terms of those full range of options, but we will want to work with the council, obviously, to think about how the choice or options around location can be maximised with the local authority planning, future planning arrangements, to try to coordinate the development of the facilities with the future plans of the council. So I think there's an enormous opportunity for us to think wider than purely 2 hospital builds and think very much about the wider socio-economic benefit to the region. Thank you.
Phil Woodford.
Thanks, Chair. Yeah, just in response to Sean, it's a great question. Sean, I share a lot of Lizzie's comments even though I'm a staff member, and concerns, most of them pretty much well allayed by now. But an area which I think members could help us with, because I think you're closer to the people on the ground, is, I don't like the term hard to reach. I don't believe there's anybody hard to reach. I just think it requires a bit more effort. I was told there was a group of people down the road from where I live were hard to live. I knocked on their door and they opened it. It didn't seem that difficult. And I think really from yourselves, it would be great if you've been through things before to help us connect with some local communities that aren't heard of enough. That would be my ask, because I don't want anyone to go missing and having their say. Thanks, Chair.
County Councillor Gina Dowding.
Good morning. Thanks very much for the presentation and for the information provided. And as has been said, I represent Lancaster Central. In fact, I can see from here the tower at the RLI from my window. And as has been said, there was a lot of concern expressed by the initial publicity on this this initiative. So I totally agree that people are concerned about ageing buildings, although I have to say some elements of the RLI, quite a substantial part of the current estate, has actually been built since I lived in Lancaster, and I've been here for 35 years, so actually since the mid-80s. So there were just two things, rather than repeating issues that have already been said. Is it possible to, and I'm fully aware about the outcomes, that we aim for the best clinical outcomes, and that they can, in terms of specialised treatment, be done where there's a higher number of patients treated and you get that expertise building up. But I think we have to recognise as well the value of visitors, patients visitors adding to their speed of recovery and outcome. So I'm most concerned about this concept of the super hospital. It was a shame that it was talked about in that initial publicity. Is it possible that you could actually rule that out so that everybody in their localities can relax, so that people in Lancaster know that they will not be losing their local hospital, people in Preston can relax, that there will be at least that confirmation that the local A&E and key core services will be available in their community. So that's the first thing, because I think that would really help the process going forward to actually rule out those things that have caused most alarm. And secondly, in terms of looking for new sites, because I gather that in terms of the RLI, at least, it said that refurbishment isn't possible. There are other sites in our district, the Lancaster and Morecambe district, that might be more appropriate between our two. For example, our two centres of population between Lancaster and Morecambe. There are other sites available, and who's doing that scoping of other geographical sites? Thanks very much.
So I'm bringing Jerry Hawker there.
Yeah, thank you, Gina, for the question. As I started off right at the start of the presentation, I stressed that we were still early stages at this. Like you, like many others, it is regrettable that there was a focus on one single option here. There are a range of options, and as I stressed, we will have to consider options that take into account the recommendations of our clinical community. That's not just the hospital ones. We have two of our local GPs on the call here today to reflect that this is about the whole of our clinical community. So we have to look at the clinical options. We will have to look at the accessibility options, but we also have to look at affordability of the programme. All three of those factors will have to be taken into account. At this stage, I don't think we can rule out any option. We have to go through a process that considers a long list of options, which will then be shortened down to a short list. But I can stress and reinforce that we will be taking a very balanced view, considering all three of those different considerations, and most importantly, the views of the public in terms of any options that go forward for public consultation. So it's a little early for me to rule out any of those options, but we are very, very clear that we will be taking into account the full views of the public when we go to consultation.
Jeff Joliffe.
Thank you, Chair. The conversation is very much about buildings at the moment, and actually I'm much more concerned about clinical services. You need to know what you've got at the moment, and you've got some really poor outcomes in health in Lancashire and South Cumbria. And that's not for want of trying, that's just where we are. And we need to use this as a catalyst, an opportunity to transform the way we deliver care. We deliver far too much care in hospital, we deliver far too many operations, we deliver far too many services for ill people, not promoting health and well-being. So there's got to be a transformational change in this region over the next 10 years. It's been said it's a once-in-a-lifetime opportunity, and what we've been focusing on as clinicians is actually what's the right way to care for people. What's the modern way to care for people? So, Lizzie, you mentioned maternity care, and I always quote this one. When I was a houseman in a maternity unit, it was common to lie in, that was called then, lie in and have 2 weeks in bed after your caesarean section, which is pretty poor care now, isn't it? And now people go home the next day, or even quicker.
Having had 2 caesarean sections,
yeah.
A bit of time in bed's pretty good.
Well, yeah, but you get things change, and what we need to do is predict what is the care of the future going to look like. And you know, as Jerry has said, it's more than just about the 2 hospitals, about all the hospitals and all the components of healthcare in the ICS region. So it matters to me what happens in this building, even though I'm in Barrow in Furness, because my patients will be using some services there, no doubt, wherever these buildings are. But I'd really encourage you to think about what we're about is making the care and the outcomes for the population so much better, and that's what we're focusing on at the moment. Thank you.
County Councillor Charlie Edwards.
Thank you, Mr. Chairman, and hello everybody. And I'm sorry I was a couple of minutes late to the presentation, but yeah, I've read through the papers. Excuse me, and I completely sympathise with the comments that especially Councillor Collins has made and Councillor Dowding about Lancaster, and I just think that we need to make sure that the Lancaster and Morecambe community are engaged throughout this process. This is a scary proposition, and I can't. And given the fact that for the last 4 years we've been on the committee, so much of our time has been spent on Chorley A&E and the repurpose of Chorley Hospital, and that's and rightly so. We've got to learn lessons from that, and we've got to make sure that the public are with us all the way. Okay, whatever proposals come forward. I'd like to make a point about the service design, and I think Dr. Joliffe has talked about it really eloquently about how we've got to make sure that it's actually the services that are what we focus on, not the build, not the bricks and mortar. And I think that's absolutely key. And what I'd really like to see come through in this initial consultation and from day one of this project is, can we align adult social care with this new hospital project? I would really like to see inside the hospital, and however we design it, we're designing step down facilities to make it easier for us to transfer people into care and freeing up hospital beds. I think having step down facilities within the facility would be amazing. And also any buildings that are left over in this process, can we keep them as community health assets and use them especially for things like public health and prevention? What I really am terrified of is we go, oh, awesome, we've got this prime bit of real estate in the middle of Lancaster, we can sell it and we can call it infirmary wing housing estate. We can't do that. Let's use that in the middle of city centre Lancaster. Let's have a massive public health, preventative health hub that could be used for educational purposes, for community, wealth building, whatever it may be. I just think that let's just think in a more holistic way, bring adult social care into the mix from day one, please. That would be my massive plea today, if that's okay. Hope everyone's well.
Right, so I'm presuming that Jerry Hawker and Sean Turner want to respond to Councillor Edwards, so I'll bring Jerry Hawker and then Sean Turner in.
Thank you, and I very much welcome that question. In part, that links back to Sean's earlier comment about this programme being much more than just about a hospital build. It is absolutely part of a much bigger commitment of the integrated care system, which in itself is a partnership with the local authorities about how we improve the long-term health and well-being of the population of Lancashire and South Cumbria. You know, the wider ambition for the ICS partnership is very much focused on prevention, early interventions, and that integrated community services. Very much what we're trying to develop. So the first and most important thing is we mustn't confuse what is a new hospital programme with our wider ambition around integrating care, getting care closer to home, much more out in the community. I am incredibly ambitious, and there's lots of good examples across Lancashire and South Cumbria where we're starting to make some real differences in our local communities, in our local towns. That has to happen very much in line and simultaneous with the hospital programme. For me, this is not a choice of one versus the other. It is absolutely about doing both. And great question. And we absolutely will be keeping social care very much part of the whole work we're doing across Lancashire and South Cumbria.
Councillor Sean Turner.
Yeah, thank you, Chair. Just to extend on what Charlie said a bit there as well. We've talked about patients, pathways and buildings, but there's also the workforce issue. And I think there's an opportunity in some of what Charlie said there about, you know, passing some of that estate over to growing our own. You've got the advent of apprenticeships, possibly in medicine. We've already, Jerry alluded to working closer with universities before. We've got several schools of medicine. We've got dentistry at UCLan, for example. Currently, we send our children for high-level dentistry to Manchester. So I would hope that them sort of options are considered as part of the scheme too.
Thank you. Councillor Kim Snape.
Hiya, yeah. Just a quick question. I represent Chorley Released. A lot of my residents actually reside close to the Wigan Hospital site, and I know they will be sort of particularly interested in terms of, are you having early conversations and engaging neighbouring trusts in your sort of thoughts around your future proposals and keeping them in the loop as you go along? Because obviously, learning from lessons in the past, I know Wigan Hospital, the trust has been quite vocal in terms of the thoughts on some of the things that were proposed for Lancashire. Thank you.
Councillor Margaret Frowns. I'll move on then. Councillor Nikki Ennisy.
Thank you, Chair. Where are we? We're still morning. Good morning, everybody. Hold on a second. Am I with you? There I am. Yes, first of all, I'm Nikki Hennessy and I'm the County Councillor for Ormskirk. And I'd like to ask about your relationship with West Lancashire CCG and the NHS hospitals, Ormskirk and Southport, in relation to all this. How's the consultation going to go with that? And on the back of what Sean's just mentioned, he must have been reading my notes. sure, in the business plan, it's surely you've got to, if you're building these huge hospitals, how are you going to staff it? You know, and again, I'd just like the reassurance that, because Edge Hill's right on my doorstep here, and we've got, so our future medical staff, that is a key thing for us, because we want them to, study here and stay in Lancashire, a future for them. So please reassure us on that sort of support that you're giving. Thank you.
Councillor Margaret France.
Thank you.
Margaret, you're not a member of the committee, are you?
I'm a co-opted member, I think.
Okay, fine. Fine, no problem.
Yeah, my question is, I'd like some reassurance that very early on in the planning stages, that account is taken about public transport, because when you consider the vast number of journeys taken to and from our hospitals at the moment, and its effect on the environment, particularly the air quality issues, I'd like to know that you are negotiating together with public transport providers in terms of ideally rail links or tram links, as well as things like bus services, because I think it's absolutely crucial that we make it easy to get to and from these hospitals if they are going to be potentially further distant to people's homes than they are at the moment. And not just staff transport alone is a huge issue, as well as the people visiting the hospitals or having outpatient procedures, what have you. So I think that's absolutely crucial when we're all looking at declaring a climate emergency and so on and so forth. Thank you.
Councillor David Borrow.
Thank you, Chair. Just very quickly, in my first contribution some time ago, I raised the question of resources, and it's never been touched on. And since then, we've had councillors talking about the importance of working with adult social care. We still are waiting for something from the government as to how social care is going to be funded. And we've also had questions about if new build hospitals are going to take place, that the existing buildings should be made available for community or other health users. Clearly, we need to have some signal from government in terms of resources. I would think it would be very unusual for the government to give money to build a new hospital on a new site and say we can keep all the existing sites and do other things with them. I'm quite certain they'll want us to sell the site and use the money towards a new hospital eventually. So I just think something needs to be said about resources. And I had nothing this morning about the sort of resources that we are talking about, because eventually we're going to have to draw up a list of parameters that will eventually lead us to what is the best solution we can get. And that includes public transport, it includes distance people have got to travel, it includes that balance between specialist services and access for residents, and it includes money. And we haven't had anything about the money. We need to have something about the money as we move forward. And if nobody said anything about money, I just think that's the glaring hole in where we are at the moment. And I think if this comes back to health scrutiny in a few months' time, I would hope we've got something about the money.
Jerry Hawker.
Yeah, thank you. And thank you for David for raising the question he picked up at the beginning. Apologies for not answering that. There are a number of questions there which I want to just very quickly touch on. If I may, the first one is just to reinforce, unless Dr. Scales want to add to that, is that we continue to engage with all the hospitals in Lancashire and South Cumbria from a clinical perspective, and we are in contact with Ormskirk as well in our work that we're doing around the future of the developments here. Public transport will be very much part of our considerations. I will go back and repeat again, we have to explore options that take into account those three different key elements: the clinical model and how best to maximise outcomes for our population, accessibility, including public transport links, and then finally affordability. David is absolutely right. We have to be realistic. This is part of a national programme. There is going to be challenges in terms of the finances moving forward, coming out of a national pandemic, as to the availability of funding. We do not have an exact figure that we are working to. What we do know is that we will continue to have to present to the Department of Health a credible financial proposal that will enable us to redevelop our hospital facilities, but within an affordable framework. And that does include what would happen to the existing sites as well within those options. So I can only stress again, we have to consider affordability within this programme. That is a requirement of the Department of Health, and that will have a consideration in any of the options that go forward in the future. Thank you, Chair.
Thank you. Councillor Durrell.
Hello, is that me, perhaps?
It just says Cynthia Guest.
Yes, Cynthia Darrelly.
Right.
Chair. Thank you for letting me speak. I'm a substitute, so you won't have seen me here at this meeting before, but from West Lancs. And I just wanted to continue the question that County Councillor Hennessy had raised, really, about where West Lancashire fits in now. So you are having big discussions, and you have all the CCGs together in the area to talk. I wondered whether West Lancs are included there. I also wondered whether Bradford and Craven are included in your discussions, because I'd like to understand what is happening for West Lancashire, and whether West Lancashire CCG are also involved in, well, it sounds like it's Merseyside and Cheshire that we are heading towards. But I think it's a reasonable question to ask you. From the point of view of the County Council, we are still part of Lancashire County Council at the moment. Thank you.
Councillor Jerry Hawker, do you want to reply to that?
Sorry, Chair, I'm just trying to help manage the meeting by responding to each of the questions, if that's helpful for you.
Yeah.
2 points just in terms of West Lancashire. First of all is to reinforce that West Lancashire CCG is part of the Lancashire and South Cumbria Joint Committee, and they will be overseeing the decision-making process and the consultation process, and clearly they do link into that committee, so are very much part of the overall programme of work. We continue to liaise with both Greater Manchester and Cheshire and Merseyside to understand the wider impact of the programme, and clearly as the options come forward, that will continue to be under review. But I reinforce again, West Lancashire CCG are very much part of this programme of work.
County Councillor Gina Dowding.
Thank you, Chair. I should just add, I am a county councillor for Lancaster Central, and I used to be a full member of this committee, but I've just remembered that I am now representing Lancaster City Council, so I'm not a full member of the committee, I'm a delegate from the City Council. Just this, I do hope that the governance team and those looking, when they're looking at affordability, will also be looking at the costs and savings in the rounds in terms of investment in public health and in primary care compared to tertiary or whatever secondary care. Because this is our opportunity to get government to think differently about the siloed funding that they make available for these things. But also, and following on from that, I noticed that you said that you've set up a new hospitals programme with 25 clinicians, acute hospitals, community and primary care. Have you actually got a public health representative on your team so that you've got that public health voice shaping the service or the way that the review goes? And might that actually be very helpful?
Can either Rebecca or Jerry Scales answer that question?
Yeah, so Gina, hi, I'm Rebecca Mallin, the Programme Director. Really good question. So we set out to get a full range of clinicians in those roles. So we were really clear we didn't just want hospital physicians and from different disciplines as well. So allied health professionals, therapists, GPs, as well as hospital doctors. I haven't got a public health practitioner as part of that group, but I have absolutely just written that down because that's a brilliant suggestion. Thanks, Gina.
And mental health, if I could just come in, is the other area that we're very conscious clearly needs to be part of this.
Jeff Jolliffe.
Yeah, thanks. I think you've got to remember just what Jerry said before. There are several different programs going on that are complementary. There's the reform of the whole system, but there's also a very strong movement around population health, which sits somewhere else. So this program doesn't work in isolation. It works dovetailing with those other systems. So population health and public health representation is well placed elsewhere in the system, this hospital program isn't primarily about building facilities for population health, but it's about building facilities for a new way of healthcare, which will be part of the whole system envisaged by public health and by primary care and by others. So it's all part of a complex system, but they are there, but not within the program itself, as Rebecca says, at the moment.
Right, I'm going to move to the recommendations now. And the recommendations are, one, that we note the information provided in this report. So I presume we're agreed on that. We provide views and guidance on how the programme can help ensure the Health Scrutiny Committee is able to undertake its duties. My suggestion to you is that we engage on this issue on a regular basis through our steering group, inviting appropriate councillors, and on any major views or areas of and on any major issues or areas of concern, steering will refer to the full Health Scrutiny Committee. Can we agree to that? I'll take silence as meaning we agree. And 3, we also note that a single joint Health Scrutiny Committee will need to be established for this programme, involving all appropriate councils. And I'll take silence as meaning that we're agreed to that.
Yeah, happy to second that, Mr. Chairman.
Thank you. So, are we all agreed?
Yep.
Right, yep. Thank you. So I'm going to move on now.
Thank you.
Thank you everyone who's taken part this morning, and thank you for answering the questions. Eddie, I've taken the vote.
Yeah, okay. All I was going to suggest was that the main committee actually has an update report, even in writing, even if it's writing rather than a presentation, every 6 months. This is of such major importance for Lancashire, for all parts of Lancashire going forward, that I think the full committee need to be kept up to speed with this.
Yes,
clearly health is developing on public health, etc.
I think we can take that on board and do that. As I say, can I thank everyone who's attended this morning, and thank you for your presentations. And you can leave now, but thank you all very much.
Okay.
Thank you.
All right. Bye-bye. Thank you.
Thank you.
Thank you. Bye.
Thank you.
Right. Item 5